This is Mayo Clinic Talks, a curated weekly podcast for physicians and healthcare providers. I'm your host, Daryl Chutka, a general internist at Mayo Clinic in Rochester, Minnesota. Heart disease is extremely common, and traditional medical treatment has been limited in managing the burden of this disease, especially in those with congestive heart failure. Transplantation has potential for benefit, but organ shortage remains a significant barrier. It's hoped that regenerative medicine will help solve this unmet need with new treatment options to repair damaged heart tissue. With us to discuss regenerative medicine in the cardiovascular system is Dr. Atta Behfar, a cardiologist with expertise in advanced heart failure and transplantation. Welcome, Atta.
Thanks so much for having me.
Let's start by you describing the regenerative potential of the heart and the cardiovascular system.
The heart, unlike what has potentially been taught in med schools, does have some regenerative power. Both the heart itself and tissues like the bone marrow and even cells in your bloodstream can work together to maintain what's called homeostasis in the heart. That means with routine wear and tear, the heart has the capacity to heal itself. Big issue that occurs is with massive insult or with non-physiological insults. That can be something as straightforward as chronic high blood pressure, or it could be something as devastating as a heart attack that overwhelms this ability of the heart to maintain its normal health. And really the field of both advanced heart failure and regenerative cardiology is focused on trying to restore normalcy in the heart or replace the heart when those issues occur.
So when scar tissue forms as a result of a large MI, that doesn't really go away. That pretty much stays. It's non-viable, non-functioning cardiac tissue, right?
That's right. And the injury that occurs with a heart attack is really insurmountable by the heart and its normal processes to heal.
Well, in the field of cardiology, what areas of our current standard of care clinical approaches do you struggle with in terms of patient care?
I think in the initial phase of insult, although as you look right now in medicine, when someone says, I'm having chest pain, there is massive infrastructure to get that individual into an ER and get them to the cath lab to make sure if they are having a heart attack, that those blood vessels are opened up. But nevertheless, this period in time where you don't know if you're having heartburn or if you've eaten something and you may wait a couple hours before sounding that alarm, results in perpetual damage in the heart as you're deciding if you're having a heart attack or not. That isn't something that we can yet correct for simply by opening up the plumbing. In other words, by opening up the blood vessel of the heart, the sustained period of damage cannot be reversed right now with current technology. So that's a big challenge that we've been trying to address. And then if we take that same individual and now fast forward 5 to 10 years, where now they have a scar and their heart has worked hard to try and compensate for that scar and finally succumbs to it. In other words, it cannot remodel anymore to try to make up for that deficit. That advanced heart failure stage is very difficult to manage. And what we try to do is employ increasingly aggressive types of both medical therapies and technologies to try and extend the life of these individuals.